Hi everyone, Mental Health Connoisseur welcomes you all to the public lecture on sadness versus depression. Understand why it is important to know the difference between the two psychological states. Know the crucial difference between sadness and depression. Know the sign and symptoms of depression, causes of depression. What should a person do if he or she feels persistently sad? How a loved one with depression can be helped. Coming to the point, why is it important to the difference between sadness and depression? If we don't know the distinction between the two, we can neglect a serious mental condition known as depression that requires treatment and has a significant impact on our long-term physical and mental health. Or, on the other side, we can overreact to a normal emotional state that is sadness. Now know an important distinction. Sadness is a normal human emotion. We all experience it at stressful times. It usually occurs in connection with life events. For example, loss of a job, failure in exams, relationship breakup, etc. It usually goes away with time. And one can get relief by crying and talking about it. However, depression is a mental illness known as a mood disorder. When we are depressed, we feel sad about everything. Depression may and may not be associated with stressful or difficult situations. Everything is going well in life, still one may feel depressed. In depression, one may feel worthless, helpless, hopeless. Lack of energy, motivation, inability to enjoy anything, lack of interest in everything, getting easily frustrated, and impatient are the common characteristics of depression. Depression also has a negative impact on our sleeping and eating patterns and daily life functioning. To be diagnosed with depression, symptoms must be present for at least 2 weeks. So, if low mood or sadness gets worse or lasts longer than 2 weeks, the person should consult to psychiatrist or clinical psychologist. Know the signs and symptoms of depression. Generally, different people experience different symptoms of depression. These symptoms include persistent sad, anxious, or empty mood, feelings of hopelessness, worthlessness, or helplessness, feelings of guilt, loss of interest or pleasure in activities which was pleasurable before, decreased level of energy, or fatigue, difficulty concentrating or forgetfulness, inability to sleep, awakening early in the morning, or excessive sleeping, a decrease in appetite, death wishes, suicidal ideas, or suicide attempts, irritable mood or restlessness. Depression commonly manifests through bodily symptoms such as pain in the body, headache, or digestive problems, etc. in the absence of a clear physical cause. It is important to understand that depression affects different people in different ways. Women with depression typically show symptoms as sadness, worthlessness, and guilt feelings. Men with depression most likely feel tired, irritable, angry, lose interest in work, report sleep problems, and indulge in the misuse of drugs or alcohol. Younger children with depression may show it through sickness behavior, clinging with parents, may refuse to go to school, or worry that a parent may die. Older children with depression may have an irritable mood, may face trouble at school. They can reflect it through anxiety symptoms, eating disorders, or substance misuse. Cause of depression can be genetic, biological, environmental, for example, lockdown, the death of a loved one, financial constraints or job loss, etc. Psychological, for example, personality characteristics, low self-esteem, maladaptive thinking process. Depression can occur with medical illnesses, such as diabetes, cancer, heart disease. Medications used for the treatment of these illnesses may lead to depression symptoms. What to do if one is persistently having a low mood? Consult psychiatrist or clinical psychologist or psychiatric social worker or trained mental health professionals immediately. Professionals will conduct an interview, physical examination, and lab tests to reach any conclusion about one's health condition. They will rule out other medical conditions that show symptoms similar to depression. After the confirmed diagnosis of depression, you can be treated with medication or psychotherapy or a combination of both depending upon the severity level of depression and several other factors. If someone is started on antidepressant medication, it may take 2 to 4 weeks to start showing improvement. Antidepressants can have side effects, but many side effects may go away over time. Don't stop treatment on your own, without talking to your doctor. Go for regular follow-up. If you are referred for psychotherapy or if you continue therapy sessions with your clinical psychologist, take regular sessions with your therapist. Therapy will help you to find out alternative ways of thinking and behaving that may contribute to improvement in depressive symptoms. Therapy will help you to develop adaptive and positive coping strategies to deal with difficult life situations that may further lessen your negative emotions and unhelpful thoughts. One can also try to indulge in other helpful activities, such as try to do things that you used to enjoy earlier. Try to be active and exercise. You can just divide large tasks into small ones and try to finish one by one at a time. Spend time with other people. Please avoid the use of alcohol or self-medication with non-prescribed drugs. What to do if a loved one goes through depression? Ask him or her to consult a psychiatrist, clinical psychologist, or psychiatric social worker. Try to be supportive and understanding. Ask them to join for walks and other activities. Make sure they are taking medicines regularly on time. Set reminders for them. Make sure they don't miss psychotherapy sessions. Never ignore their comments about suicide, and immediately report it to their doctors. Never ever say to them it's all in your mind, or choose to be happy. It makes the person more helpless. This was all in favor of public welfare. I hope it was helpful to you. Mental health connoisseur, thanks for listening patiently. Subscribe the channel for more videos on mental health topics.